Namaskar. The new year brings a fresh ray of hope in the form of COVID-19 vaccine. The vaccines made in India are totally safe, effective, and with good immunogenic response against COVID-19 disease. So trust the vaccines made in India. Do take the vaccine at your turn and do not believe in hearsay. Remember, dawai bhi aur kadai bhi. Even after taking the vaccine, continue to wear a mask, observe physical distance of 2 meters, and regularly wash hands. For more information,
Well, we all know about this audio visual info. इतना बार रिपीट करते हैं, बोलते ही जाते that it definitely lasts for a longer time in our head. I mean, hammer तो हो ही जाता है और बोलते रहते हैं vaccines ले लो.
It's so useless because you don't know what to do next. It's like vaccine ले लो, vaccine ले लो, vaccine ले लो. अरे कहाँ से ले भाई, किससे ले? ये तो कोई आलू या कांदा थोड़ी है कि बाजार में जाए तो ले ले.
क्या vaccines ले? ये तो बोलना चाहिए ना, like क्यों ले vaccines, कहाँ से ले, किससे ले.
My name is Dr. Manish Kulshrestha and I am a house physician at the Emergency Department of Medical College, Kolkata. There are no guidelines which ask a person to get a RT-PCR test done before getting vaccinated. Vaccines are effective on a community level. They have the vaccines which are available in India, Covaxin and Covishield. Both have had shown good efficacy levels in the clinical trials and thus they are in the public forum right now. Everyone above the age of 18 is eligible for taking the vaccine, but there are a few contraindications. If you are pregnant, if you are lactating, or if you are having a history of having an anaphylactic shock or an anaphylactic attack by taking vaccines or injectables or a previous dose of COVID vaccine, you're not eligible for the next dose. If you are having COVID symptoms, you are still supposed to take the vaccine, but after 14 days of isolation. And if you are COVID positive, you should keep a gap of 4 to 8 weeks before getting vaccinated. The side effects of COVID vaccine are similar to the side effect of most other vaccines we take. People can have painful swelling or pain in the site of injection for a few days. They can also have fever or body ache or headache. These are just the way your body is acting towards the vaccine and creating immunity in your body. So you should not be worried about them. They can easily be cured by taking paracetamol following vaccination. Some people, very few people have allergic reactions, but don't worry about that. The people who are present at the vaccination site should guide you for the same. Vaccines are a preventive measure. They do not ensure 100% efficacy. There are people who are suggesting that they have been infected after taking 2 doses of vaccine. That does not mean that the vaccines are not working. Vaccines work on a community level. They increase the herd immunity of the population. They do not work on an individual level. That's why more the people come forward and get vaccinated, lesser will be the chance of every person catching the disease. Presently, there have been reports that suggest that COVID-19 is not a disease which is spreading by merely droplet infections, but is airborne. The meaning of that is that now our precaution level should change. We cannot use a cloth mask anymore because if it is airborne, the particles are so small that they will pass through the cloth and it will provide 0% efficacy or protection. That's why I suggest that all of you at least go for a surgical mask or a N95 mask if you can afford that. But a surgical mask also has 90% efficacy and an N95 mask, as the name suggests, has 95% efficacy against viral particles in the air. With my work experience in the Emergency Department of Medical College, Kolkata, I have seen so many patients coming in with shortness of breath right now that it is very scary. The situation is getting out of hand and we really want to emphasize on the fact that we need people to get vaccinated. We need people who get themselves tested on time, because if we have seen many cases that they have come in with requirement of oxygen because of shortness of breath and they have not been tested, so we do not know their COVID status, and that is a very difficult situation for us because we cannot admit the patient in a normal ward, neither can we shift them to a COVID ward. So in such situation it's a dilemma. So it's always best to get yourself tested as soon as you get the symptoms. And people who have vaccinated themselves, we have seen that the disease is milder in them. So vaccines do not just prevent you from getting the disease, they also prevent the severe form of the disease. So I urge all of you to get tested whenever you show symptoms and get the vaccination done as soon as possible.